Hi, students. Ms. Miles here. Thanks for visiting the Miles Ahead classroom today. I've got an exciting lesson planned about a very important job. Can you imagine what we would do without these amazing people and the work they do? That's right. We're talking about doctors. Today, we're going to explore all the big questions like who they are, what they do, where they work, and how someone becomes a doctor. Let's dive in and get started. Who is a doctor? A doctor is a person who helps people stay healthy and feel better when they're sick or hurt. Doctors are trained experts who know all about how our bodies work. They treat illnesses, fix injuries, and teach us how to take care of ourselves to stay healthy. Doctors work in places like hospitals, clinics, and offices, and they care for people of all ages, from babies to grandparents. Their job is to make sure everyone stays strong, happy, and healthy. What do doctors do? Take care of sick people. They figure out what's making someone feel bad and help them get better with medicine or treatments. Doctors are like detectives for our health. When someone feels bad, they ask questions about how the person is feeling and might do tests to figure out what's wrong. They then decide the best way to help, which could include giving medicine, recommending rest, or suggesting other treatments like therapy. They care for illnesses like colds, fevers, or more serious conditions like infections. Help with injuries. Doctors fix cuts, broken bones, and other injuries so they can heal. When someone gets hurt, like falling and getting a cut or breaking a bone, doctors step in to help. They might clean and bandage a wound, put a cast on a broken bone, or even perform surgery if needed. Doctors make sure injuries heal properly so the person can feel better and get back to their normal activities. Do checkups. They check your body to make sure everything is healthy and working well. Doctors don't just help when we're sick, they also check on us when we're healthy. During a checkup, they listen to your heart and lungs, check your weight and height, and make sure your body is growing and working as it should. These visits help catch problems early and keep you healthy. Give vaccines. Doctors give shots to protect people from getting sick. Doctors protect us from getting sick by giving vaccines, which are special shots that teach our body how to fight off certain illnesses. For example, vaccines can protect us from the flu or chickenpox. Getting vaccinated helps keep everyone in the community healthy. Teach about health. They help us learn how to stay healthy by eating well, exercising, and washing our hands. Doctors are also teachers. They explain how to stay healthy by eating nutritious food, getting exercise, and keeping clean. For example, they might teach kids how to brush their teeth properly or remind people to wash their hands to avoid germs. Work in emergencies. Doctors help in big emergencies to save lives and care for people quickly. In emergencies, like accidents or sudden sicknesses, doctors work quickly to save lives. They might stop bleeding, treat burns, or help someone breathe. Emergency doctors are trained to stay calm and help people right away when they need urgent care. Care for everyone. Doctors help people of all ages, from babies to grown-ups. Doctors help all kinds of people, babies, kids, adults, and even elderly people. Some doctors specialize in caring for certain groups, like children's doctors, pediatricians, or doctors for older adults, geriatricians. No matter your age, there's a doctor ready to help you feel your best. Where do doctors work? Doctors work in many different places to help people. Hospitals. Doctors take care of people who are very sick or need surgery. Hospitals are places where doctors take care of people who are very sick or need special treatments. People might stay in the hospital for a few days if they need extra care, like recovering from surgery or fighting a serious illness. Hospitals have different departments for different needs, like a maternity ward for babies, an intensive care unit, ICU, for serious conditions, and surgical rooms for operations. Doctors in hospitals work as a team with nurses and other staff to help patients get better. Clinics and doctors' offices. People visit doctors here for checkups or when they have small health problems. Clinics and doctors' offices are smaller places where people can visit for regular checkups or for smaller health problems, like a sore throat or a rash. These places are usually not for emergencies. but they're perfect for preventive care, like getting vaccines or advice about staying healthy. Doctors in clinics and offices help you stay healthy and catch problems early so they don't get worse. Emergency rooms. Doctors in the ER help people who need quick care, like after an accident. Emergency rooms, ERs, are for situations that need quick medical attention, like accidents, sudden pain, or breathing problems. Doctors in the ER are trained to act fast and treat serious problems, such as broken bones, cuts that need stitches, or heart attacks. They often work with other emergency workers, like paramedics, to give the best care as quickly as possible. Schools. Some doctors, like school nurses, help kids if they feel sick at school. In schools, some doctors or nurses help students stay healthy. They take care of kids who feel sick during the day or who might have accidents, like falling on the playground. School nurses also check kids' health during the year, like measuring height and weight or testing vision and hearing. They help kids stay healthy so they can focus on learning. Communities. Some doctors travel to help people in areas without hospitals or clinics. Some doctors work directly in communities, especially in places where there aren't many hospitals or clinics. These doctors might travel to small towns, villages, or remote areas to provide care to people who can't easily see a doctor. They might set up temporary clinics, give vaccines, or teach people about staying healthy. These doctors are very important in helping everyone get the care they need, no matter where they live. Special labs or research centers. Some doctors study new ways to treat sickness or make new medicines. Some doctors work in labs or research centers to study diseases and find new treatments. They might look at how viruses work, test new medicines, or discover better ways to do surgery. These doctors don't see patients every day, but their work helps improve healthcare for everyone by finding cures and making treatments safer and more effective. Doctors can work anywhere they are needed to help people stay healthy and feel better. How do doctors help us? Feeling better. When we are sick or hurt. Treating sickness. Doctors give us medicine or treatments to help us feel better when we're sick. Doctors help us when we're sick by figuring out what's wrong and finding ways to make us feel better. They ask questions about how we feel, check our body, and sometimes use tests, like blood tests or x-rays, to learn more. Once they know what's wrong, they give us medicine, suggest resting, or recommend treatments like therapy. For example, they might give medicine for a fever or special exercises for a sore muscle. Fixing injuries. Doctors take care of cuts, broken bones, and other injuries to help us heal. Doctors take care of injuries like cuts, bruises, or broken bones. They clean and bandage wounds to stop infections, put broken bones in casts to help them heal, and sometimes do surgeries if the injury is serious. Doctors also teach us how to take care of our injuries at home so we heal faster and feel better. Checking our health. They do checkups to make sure our bodies are healthy and working well. Doctors help us stay healthy by doing regular checkups. During these visits, they check things like our height, weight, and blood pressure. They listen to our hearts and lungs, look in our throats and ears, and make sure we're growing and developing well. Checkups are important because they help find problems early before they get worse. Preventing illness. Doctors give us vaccines and teach us how to stay healthy, like eating good food and exercising. Doctors work hard to stop us from getting sick in the first place. They give vaccines, which are special shots that protect us from diseases like the flu or chickenpox. They also teach us good habits, like washing our hands, eating healthy food, and getting enough sleep, which keep our bodies strong and healthy. Helping in emergencies. Doctors take care of people who need quick help, like after an accident, or when someone feels very sick suddenly. When there's an emergency, like a car accident, a bad fall, or someone suddenly feeling very sick, doctors act fast to help. They treat injuries, stop bleeding, and do whatever is needed to make sure the person is safe. Emergency doctors are trained to stay calm and work quickly, helping people get better in scary situations. Caring for everyone. Doctors help babies, kids, and adults stay healthy and happy. Doctors take care of people of all ages. They help babies by making sure they grow strong and healthy. Doctors care for kids by giving them checkups and treating illnesses like colds or ear infections. For adults and elderly people, doctors help with everything from managing daily health to treating more serious illnesses. No matter how old you are, doctors are there to help keep you healthy and happy. Why are doctors important? Doctors are important because they help us feel better. Doctors treat us when we're sick or injured. Doctors are experts at helping us when we don't feel well. If we have a fever, a cough, or even a broken bone, they know what to do to make us better. They examine us, find out what's wrong, and provide medicine, bandages, or other treatments to help us heal and feel good again. They keep us healthy. They teach us how to stay healthy by eating well, exercising, and taking care of ourselves. Doctors don't just help when we're sick, they also help us stay healthy. They give advice about eating nutritious food, staying active, and getting enough rest. Doctors might remind us to drink plenty of water, play outside, and wash our hands to avoid germs. Following their advice keeps our bodies strong and helps us avoid getting sick. They save lives. Doctors are trained to handle emergencies and serious illnesses to protect and save lives. Doctors are trained to handle serious situations where someone's life is in danger. In emergencies, like accidents or severe illnesses, doctors act quickly to provide care that can save lives. Whether it's performing surgery, stopping heavy bleeding, or helping someone breathe, doctors work hard to protect us when it matters most. They prevent illness. By giving vaccines and regular checkups, doctors stop people from getting sick in the first place. Doctors help stop us from getting sick before it even happens. They give vaccines that protect us from diseases like the flu or measles. Regular checkups also help doctors catch any small problems early, so they don't turn into something bigger. This way, we stay healthy and strong. They help everyone. From babies to elderly people, doctors care for people of all ages. Doctors care for people of all ages, from tiny babies to older grandparents. Pediatricians take care of kids, while other doctors help adults, or specialize in areas like pregnancy or heart health. No matter how old you are or what your health needs are, there's always a doctor ready to help. They make the world healthier. Doctors work to control diseases and improve health for entire communities. Doctors don't just help individuals, they also work to improve health for whole communities. They study diseases, share advice on staying healthy, and even travel to areas where people need extra help. By controlling the spread of sickness and finding new treatments, doctors make the world a healthier, happier place for everyone. Doctors play a big role in keeping us, our families, and our communities happy and healthy. How do people become doctors? Doctors become doctors by working hard and learning a lot. Education. Go to college. After high school, they go to college to learn even more, especially about science and how the body works. After finishing high school, people who want to become doctors go to college to study subjects that prepare them for medical school. They focus on science, especially biology and chemistry, to learn about how the body works and how living things grow and change. They might also take classes in math and health-related topics. This step helps them build the knowledge they'll need to understand medicine and care for people. Go to medical school. Next, they go to a special school called medical school, where they study medicine and learn how to help sick people. Medical school is a special school just for learning how to be a doctor. It usually takes 4 years and is very challenging. During this time, students learn all about the human body, diseases, medicines, and treatments. They study how the heart, lungs, and other parts of the body work, and learn how to find out what's making someone sick. Medical school combines classroom learning with hands-on practice. Practice with real patients. During medical school, they work with real doctors in hospitals to practice taking care of patients. In the later years of medical school, students work alongside experienced doctors in hospitals and clinics. This is called clinical training. They observe how doctors interact with patients, learn how to perform exams, and even practice giving treatments under supervision. This hands-on experience helps them build confidence and skills for when they become full doctors. Special training, residency. After medical school, they choose a specific area of medicine, like being a children's doctor or surgeon, and spend a few more years learning and practicing that specialty. After graduating from medical school, new doctors choose a specific area of medicine to focus on, such as pediatrics, helping kids, surgery, or cardiology, heart health. They spend several years in residency, a training program where they work in hospitals and clinics under the guidance of senior doctors. This allows them to gain in-depth knowledge and experience in their chosen specialty. Pass big tests. They take important exams to show they're ready to be doctors. Becoming a doctor requires passing important exams to show they have learned everything they need to know. These tests are very difficult and make sure that doctors are ready to care for people safely. Passing the tests is a big accomplishment and an important step toward becoming a licensed doctor. Start helping people. Once they finish all their training and pass the tests, they can officially work as doctors and help people stay healthy and feel better. Once they finish their training and pass their exams, doctors can officially start their careers. They might work in hospitals, open their own offices, or join clinics to help people stay healthy and feel better when they're sick. By this stage, doctors are fully trained and ready to make a difference in their patients' lives. Fun comparison. Superheroes. Doctors are like superheroes who take care of us and make sure we can live our best lives. I hope you enjoyed learning about doctors. Before you leave the Miles Ahead classroom, I have a quick worksheet for us to complete together. We'll be labeling this picture of a doctor. Let's start. The first one is glasses. Doctors use glasses in their job to enhance their vision and improve their ability to perform tasks accurately. Here are a few specific ways glasses help. Reading and examining details. Glasses can help doctors clearly read small text, such as patient charts, prescriptions, and medical records. Conducting examinations. Clear vision is essential for closely examining patients during checkups, like looking into the throat, eyes, or ears. Performing procedures. Some doctors wear specialized glasses, such as magnifying or surgical loupes, to see fine details while performing surgeries or other precise medical procedures. Protecting eyes. In some cases, doctors may wear safety glasses to shield their eyes from fluids or particles during procedures. Glasses ensure doctors can perform their work with the accuracy and precision needed to care for their patients. Next, clipboard. Doctors use a clipboard in their job to stay organized and keep important information easily accessible. Here are some ways they use it. Taking notes. Doctors use clipboards to jot down notes during patient consultations or while reviewing medical charts. Holding patient records. Clipboards can hold patient forms, charts, or medical histories for quick reference during examinations or rounds. Writing prescriptions. A clipboard provides a stable surface for writing prescriptions or filling out forms. Tracking progress. Doctors can use clipboards to check off tasks, such as treatments, tests, or follow-ups for patients. Mobility. Clipboards are easy to carry, allowing doctors to move between patients while keeping critical information on hand. Clipboards help doctors stay efficient and organized, ensuring they provide the best care possible. Number 3. Shoes. Doctors rely on comfortable, supportive, and often specialized shoes to perform their jobs effectively, especially given the physical demands of their work. Here's how shoes play a crucial role. Comfort for long hours. Doctors often spend long hours on their feet during rounds, surgeries, or shifts. Comfortable shoes help reduce foot fatigue and discomfort. Mobility. Shoes with good grip and support allow doctors to move quickly and safely, whether they're rushing to an emergency or navigating hospital corridors. Hygiene and safety. Many doctors wear closed-toe shoes to protect their feet from spills, sharps, or accidental exposure to bodily fluids. Some shoes are designed to be easy to clean for maintaining hygiene, preventing injuries. Properly designed footwear reduces the risk of slips, trips, or falls in fast-paced medical environments. Specialized features. Some doctors, especially surgeons, wear orthopedic or anti-fatigue shoes to support their posture and prevent back or leg pain during extended procedures. The right shoes are essential for doctors to perform their duties comfortably, safely, and efficiently. Number 4. Stethoscope. Doctors use a stethoscope as a vital tool to listen to sounds inside a patient's body, helping them assess and diagnose various conditions. Here's how doctors use a stethoscope in their job. Listening to the heart. Doctors place the stethoscope on the chest to hear heartbeats, rhythm, and any abnormal sounds, like murmurs or irregularities. Checking lungs. By listening to the lungs, doctors can detect wheezing, crackling, or other sounds that may indicate asthma, pneumonia, or fluid buildup. Examining the abdomen. Doctors use a stethoscope to listen to bowel sounds, which can help diagnose issues like blockages or digestive disorders. Measuring blood pressure. A stethoscope is used with a blood pressure cuff to listen for the sounds of blood flow and determine systolic and diastolic pressure. Monitoring blood flow. Doctors may use a stethoscope to check for normal blood flow in arteries, ensuring there are no blockages or irregularities. The stethoscope is a key diagnostic tool that helps doctors gather important information about a patient's health quickly and non-invasively. Next, white jacket. A white doctor's jacket or lab coat is more than just a uniform. It serves several practical and symbolic purposes in a doctor's job. Here's how it's used. Professional identification. The white coat helps patients and colleagues recognize the doctor's role, establishing trust and authority in medical settings. Protection. The coat acts as a barrier, protecting the doctor's clothes from spills, stains, and exposure to bodily fluids or chemicals. Hygiene. Lab coats are easy to wash and sanitize, promoting cleanliness in environments where hygiene is critical. Carrying tools. The pockets of the coat are handy for carrying small tools, such as pens, notepads, stethoscopes, and other essentials needed during rounds. Symbol of knowledge and care. The white coat is a universal symbol of the medical profession, representing a commitment to patient care and scientific expertise. Doctors wear their white jackets not just for practicality, but also as a sign of their dedication to the health and well-being of their patients. Last, pants. Doctors use pants as part of their work attire to ensure comfort, practicality, and professionalism while performing their duties. Here's how pants play a role in their job. Comfort and mobility. Doctors often work long hours and need pants that allow them to move easily, whether they are walking between patient rooms, standing during surgeries, or performing other tasks. Protection. Medical pants, like scrubs, provide a protective layer against spills, stains, and exposure to bodily fluids. Hygiene. Many doctors wear scrubs, which are easy to clean and sanitize, helping maintain a sterile and professional environment. Professional appearance. Pants are part of a doctor's uniform, contributing to a polished and professional look that helps build trust with patients. Utility. Some medical pants have pockets for carrying small tools or essentials like pens, gloves, or notepads. Doctors' pants are designed for both functionality and comfort, supporting them in their physically demanding and fast-paced work environment. And there you have it, students. Today, we explored the amazing work that doctors do. Being a doctor is such an important profession, and we've learned so much about it today. I can't imagine a world without doctors, and I'm so grateful for the care they provide to help us live healthy lives. Before you go, I just want to say thank you for visiting the Miles Ahead classroom today. Remember, because you stopped by the Miles Ahead classroom, you're already miles ahead. Until next time, students, stay miles ahead. Bye for now.